All right, we're 2 minutes in, so I think we can really start now. And Amanda, if you pull up the slides, if they're not already pulled up, that would be great. So I'll say welcome officially to the webinar on Open Oncology Notes, where today you'll hear about research, but even better, real world experiences of sharing progress notes in oncology settings from an oncologist, an informatician, and a patient and care partner advocate. My name is Liz Salmi, and I am the Senior Strategist of Dissemination for OpenNotes, and I'll be introducing you to the cast of characters along the way. Today's presentation is especially meaningful to me because I am also a person living with cancer. So over the last few years, everything about OpenNotes and its intersection with oncology is something I've been obsessed with. For everyone who just joined, I will repeat one more time. Welcome to Open Oncology Notes webinar. We are super excited and glad you are here to join us. We're presenting in 4 segments. So first, you're going to hear from Dr. Kate DeRoche, the director of OpenNotes. And then next, you're going to hear from our special guest presenters, a patient advocate, Rosie Bartel, who's amazing. Then you'll hear from Dr. Everett Weiss or Dr. Bertram Yuh. I was trying to remember what order they're coming in, but we'll find out. You'll find out soon, surprise. And then finally, we'll transition to open Q&A and dig into what you've been asking in the chat box. So I'm going to introduce you first to my boss, Dr. Kate DeRoche. Dr. DeRoche is the executive director of OpenNotes and an associate professor of medicine at Harvard Medical School. She is a distinguished health researcher with experience in emerging trends in health care delivery. So Dr. DeRoche, I hand it over to you.
Thanks, Liz. And I am really going to be fast today, 5 minutes, because we really want to get to the main event. My job here is to do a couple of things. One is to make sure we all are on the same page about what is OpenNotes, the briefest review of the new federal rules that mandate information sharing. And the other thing I want to be sure that I talk about is just what we're going to cover today. So today we're going to be talking about sharing oncology notes. Really all of the work that we've done around OpenNotes is focused on the clinical note. We know there are other things in the information blocking rule that you now have to share, and you may be having to share them in different ways, like test results. Your organization may be interpreting the guidance as test results need to be released immediately. We don't have a lot of research on that topic, so we're not going to be covering that today, although we know that people have a lot of questions about that. And I just want to say again, it's just not something we've done a lot of research on, but we sort of feel your pain about this change and the challenges that it presents. Okay, next slide. So OpenNotes, I want to start off just by saying what OpenNotes is not, and we are not a vendor. We are not software programmers, coders. We don't have a platform that you need to buy in order to share notes. We are a philanthropically funded initiative that's focused on improving patient care, improving the healthcare system through transparency. And you can see on this slide, most of our funding comes from major philanthropies with a little bit of federal funding and a little bit of private donor funding. And we're based at the Beth Israel Deaconess Medical Center and Harvard Med School. Next slide. So OpenNotes, small o, small n, is really just when patients can easily read their visit notes. Most of the major electronic health record vendors offer a way for organizations to share notes with patients. We are platform agnostic. It's really just patients can read their visit notes. That's what OpenNotes is. Next slide. So OpenNotes, where we stand right now, prior to April 5th, is our OpenNotes started as a small pilot project in 3 organizations, one on the West Coast, 2 on the East Coast, about 100 primary care docs, and then about 20,000 patients. On the strength of what we found, which is significant benefits reported by patients and very little change in workflow reported by clinicians, we've now spread OpenNotes across the country to more than 260 organizations that we know are sharing notes with patients through a patient portal. And among those organizations in total have about 54 million people signed up. So that's 54 million people on a portal somewhere with access to their notes. Next slide. So here's what we're all here to talk about. April 5th, big changes coming. This is the implementation of the 21st Century Cures Act, which was passed during the Obama administration. And this act, which was primarily about biomedical innovation, has a section in it that's focused on improving interoperability of data. And there is a line in there that says, and I'm paraphrasing here, but it essentially says, and patients need to have access to all of the information in their electronic health record without charge or delay. So fast forward, almost 5 years later, and we're now at the information blocking rule, which requires that organizations on April 5th share an expanded set of information with patients through the portal, and it includes 8 different kinds of notes. So you can see that on the right-hand side of the slide. Those are the notes that need to be shared. So again, this is the implementation of the 21st Century Cures Act. Next slide. There are a few exceptions for note sharing. So there are 4 exceptions. One, basically they fall under this idea of preventing harm. So that's the primary way you could keep a note back if a clinician feels that a note has the potential to cause physical harm to the patient or another person. But the blocking should only be on a note-by-note basis and no broader than necessary. Next. And that is it for me. I'm going to turn it back over to Liz to introduce Rosie.
Thank you, Kate. It's always helpful to have that background and perspective as everyone's joining and getting started back with the webinar. And now I want to introduce Rosie Bartel. Rosie Bartel is a widow, a mother, a grandmother, an educator, and a passionate patient advocate. She serves on numerous national advisory councils, including the National Health IT Patient Family Advisory Council. And she collaborates with medical professionals and researchers on projects to improve patient safety and transform patient-clinician communication. I had the pleasure of co-presenting with Rosie at the Everett user group meeting in 2019, back in the day when we all got together in person. And she has an incredible way of helping us all understand the why for OpenNotes as a patient, but also as a care partner. She's incredible, and I know you will love her too. Rosie, please take it away.
Good afternoon. My story began in 2009, and it was a story that I thought was going to be very simple. And I had a knee replacement, and 2 weeks later, it developed into a MRSA staph infection. That staph infection has led to 58 surgeries, over 200 hospitalizations, septic shock more than 12 times. I have had 3 different amputations, first 6 inches above the knee, then my hip, and then most of my right side of my pelvic bone. All of those things led to multiple doctors, multiple visits, multiple testing, all kinds of things. At the beginning, I had a horrible time just keeping doctors crossing out of their silos into another silo. And so I felt like sometimes a yo-yo going back and forth. One doctor would say one thing and another doctor would say another thing. Orthopedic, infectious disease, primary care doctors, all of those coming into the play, hematologists, all of those. Eventually, my infectious disease doctor said, this isn't working, and I have a friend in orthopedic oncology who I think might be able to help you. Now you say, but you didn't have cancer. No, I didn't, but this doctor, as I was told, dealt in weird things, and what was happening to me was very strange. So I went to him, and right away, the communication was better. And as soon as notes became available, the communication even became better. Every time I would go to the infectious disease doctor, he would write a note, and that note was then my property. And when I went to the orthopedic surgeon or to the hematologist or to my primary care doctor, I had his note, and the same happened with the orthopedic oncologist. He wrote notes, And same happened with the hematology oncologist. He wrote notes. So I had a tracking method. I wasn't being tested for blood every time I went everywhere. Things got a lot easier. And notes for me became my lifeline. My orthopedic oncologist was 2.5 hours from my home. It was nice to be able to go to my notes before having to even travel to another appointment or calling about something I was concerned about. It was nice to be able to go to my notes and say, oh, that's what he meant. Because even though you think you heard everything, you don't always hear everything the way that he meant it. But when you read it, you might say, oh, that's what he meant. And there was a point where my husband literally had to pack my wound for 15 months every day. And that explanation in my notes helped that happen seamlessly for 15 months. That husband of mine, as you heard in my introduction, I'm now a widow, became ill himself in March of last year. The COVID time, he went to a doctor early on, just before the shutdown in our state. And the doctor kind of blew him off and said, oh, well, you and Rosie aren't traveling as much. You're not getting as much exercise. I think you need more exercise. And I think your backache will go away. Well, the backache didn't go away. And eventually we heard that there was a chiropractor in town that was still practicing. So we went to the chiropractor and he visited the chiropractor a lot. And finally the chiropractor said, Rosie and David, there is no answer here. I think you need an MRI. So he went back to the primary care doctor and said, I need an MRI, and they arranged it. On June 26th, he had his MRI. That afternoon, he was called into the doctor's office and was told he had 2 kinds of bone cancer, and they were secondary to something else. Immediately, you know who I turned to? I turned to my 2 oncology friends. And I originally thought maybe the orthopedic guy, but then when they said secondary, I went to the general oncologist, hematologist, and said, I need help. We need help. We need it now. And so he immediately found us room the next Tuesday. So we were Thursday to Tuesday, and we met with him. I remember saying to him, I want answers now. And he said, Rosie, I wanted answers yesterday when I saw the original MRI. And that's how our relationship continued. It was COVID time. It was very hard for me to be part of the visit. They said they would allow one time me being part of the visit. My husband, David, immediately said, I'm feeling like I can't keep my mind together. I'm not being able to handle this on my own. I need Rosie to be here when you're talking to me and when you're meeting with me. And he said, I will make that happen. And he wrote that in his notes, and he wrote it. And then when we got to check out, they said, oh no, you can't. You had one time more than we thought you should have. And I said, you need to look at this note. You need to look at what he said. You need to look at the value of me. And it didn't get solved there in that office, but it got solved later by phone calls I made. Those notes have been, his notes have been phenomenal for us. David lost his life about a month later on July 28th. We didn't know if we did all the right things. From the beginning, we were told that he had less than 6 months to live and probably on the short end. They said the only thing that they could do was try to find the source of the cancer, but even if they did, it wasn't going to be really that helpful. The only thing it could make a decision what kind of comfort chemo they would provide for him. They said that comfort chemo could go one of 2 ways. It could either help his pain or it would hinder his pain and make it worse. And so he had 1 dose of comfort chemo and he died 8 days later in a lot more pain than even before his comfort chemo. We knew that we did what David wanted. We knew that we made the right decision. About 3 days before he died, I, in the middle of the night, literally called my primary care doctor and said, we need help. We need hospice now. And we got it in the middle of the night. But it was all of the things that were in those notes that helped me relate where we were at to our primary care doctor, to hospice, to each other. Those notes are like gold to us. They are like what gave us purpose. We know that we did the right things. We did the best things for David, for our family, for us going forward. It's been a hard time, but it's been a good time. Now, shortly after David died, I'm a part of the Barrel Institute Patient and Family Advisory Council, and I was asked if I would write a piece for a white paper they were writing on diagnosis, and if I would write a piece about David's diagnosis. And that white paper is available through the Barrel Institute if you go to their website. But that white paper ends with my piece that I wrote about our family voice in the care for David and David's diagnosis. And I put a note in it about OpenNotes because I think many people and many physicians and many clinicians don't understand that those notes need to be written for the patient to understand and to get something from. Now, yes, all the blood work and all that information was there in David's notes, and they have some meaning for me. They have very little meaning for my children, but the notes he wrote about my father and their father, about their father and my husband, was invaluable to us and will always be part of what we take away from this, is knowing that we were doing the right thing at the right time. I hope that my story helps you understand what patients need when they go forward on this journey.
Thank you, Rosie. I appreciate you sharing your story, and I'm sure everyone who's watching today appreciates hearing your story as well, so thank you. And now I'm going to introduce our next presenter, Dr. Yuh. Dr. Bertram Yuh is the Associate Chief Medical Information Officer and a clinical professor at City of Hope National Cancer Center. He's board certified in urology and clinical informatics and is a strong advocate for transparency and information and data to bolster physician-patient relationships in oncology settings for people facing cancer. I got to hang out with Dr. Yuh in the summer of 2019, right before City of Hope launched their OpenNotes efforts. And I have been impressed by their journey, and I'm excited to learn how things are going for them still today. Dr. Yuh, I hand it over to you.
Thanks so much, Liz. Can you hear me all right?
Yes.
Great. So thank you, Kate and Liz and everyone for organizing this and for everyone participating today. And special thanks to Rosie. Every time I hear your story, it really hits home and it really is exemplary in terms of why we do what we do and how we want to try to be able to help our patients. So again, thanks so much for sharing that. If we can move to my first slide, please. Great, thanks. So just a brief overview of City of Hope. We've been in existence for over 100 years, founded in 1913. We're a Los Angeles-based categorical cancer hospital and one of the original National Comprehensive Cancer Network hospitals, along with Memorial Sloan Kettering, where Dr. Weiss, my panelist who will be speaking next, also is part of. And in terms of City of Hope's experience with City of Hope's, with OpenNotes, this has really been quite a journey for us. But Liz really helped us to launch OpenNotes for our organization, and we went live with outpatient notes as well as inpatient notes a couple years ago. And since that time, we've shared a couple 100,000 notes with our patients and really had a very good experience in terms of our patients' responses to that, as well as being able to help share additional information with them and getting their feedback. So it's been a very positive experience for us overall. Next slide, please. So I did want to talk in terms of a few specific special considerations as it relates to oncologic care in the setting of OpenNotes. And this is something that I've heard from a lot of patients, but also in speaking with a lot of our providers, our doctors, our APPs, and other folks who are writing notes for our patients. And I'm going to go into some of these in more detail in the upcoming slides, but some of the specific challenges and considerations would be, number one, the complexity that cancer conditions afford and the cancer care that's involved with that. Information overload that oftentimes comes with the cancer care delivery and what we're trying to project from an information data standpoint, and the challenges with the full comprehension of this information. There's a really special role for caregivers as it relates to oncology care, which I really want to emphasize here as well today. Finally, I'll touch upon differential expectations that really exist in many different respects, ranging between patient and their care provider, but also even between various different patients, even with dealing with the same cancers. There's a lot of different expectations that can exist in that setting. And again, I think it's important for us to be able to acknowledge that and work with our patients through that. Next slide, please. So as it relates to the complexity of cancer conditions and the cancer care, we're well aware that many cancer treatments, in particular treatments that are ongoing, such as chemotherapy, stem cell transplant, patients who are undergoing complex multiple surgeries, these oftentimes require multiple follow-ups. There's a lot of interaction, as Rosie also described before, with the physicians, with their care team. And there's just a lot of complexity as it relates to their outpatient, inpatient care. And we want a way to be able to organize that and communicate that best through OpenNotes. And the impacts of these treatments are far-reaching. That can include changes from a physical standpoint, mental standpoint, also from an emotional, social, or psychological standpoint, and really in profound ways affect patients' lives and their livelihoods. And another key thing is that our understanding of cancer is vast, but still really growing daily, which brings me to my next topic. There really is a challenge that we as providers try to manage, and that is information overload and the challenges with full comprehension. As I said, we understand a lot about cancer, but every day we're learning more. The science and the research behind this is ever changing. The new clinical trials are being developed. The new emerging technologies and therapies are coming on board, and it's hard to make sense of all this. Even a lot of our clinicians struggle to keep pace with the speed that medicine's moving. And when it comes to patients who are physically having to live this and deal with this, again, trying to balance all this information can really be quite overwhelming. So we have to do our best to help them in that situation. We tend to have the mindset here at City of Hope that more information is oftentimes better, but there are some specific challenges to that. We know that the effects of the cancer itself or the treatment thereof, as it relates to things like anxiety or depression that can ensue, the effects of medications or treatments, as well as the stresses that our patients deal with, the fears that they have, their concerns from a social standpoint, or fear of loss of work. These are all factors that can affect their ability to really comprehend and assimilate this information to make the best decision for themselves. And what I've heard repeatedly from a number of our patients is, after a given visit they've had, why do they go to their OpenNotes? Why do they seek out their notes? And these all start with R, but I'll go through some of these examples. So a lot of our patients go to their notes to serve as a recap. Again, going to their OpenNotes really helps to summarize the complex care plans for the patients and their caregivers. They can see really outlined at a glance what was that discussion focused on today, and really dive into that detail, but also allows them to verify certain things such as labs and imaging results, which again, a lot of our patients, as providers, we go over that information with our patients, but beyond saying that this is normal or this is abnormal, this is a problem, a lot of times a specific data here is missing, and being able to project that through notes is something that a lot of our patients will seek out. Our notes also serve to reinforce care plans and reinforce information for our patients. And my patients tell me, I can tell what the main 3 care points that my oncologist wants to focus on are X, Y, and Z. So as providers, we oftentimes like to summarize things as, these are the most important things for you to take away here today. These are the most priority, or these are the most pressing things that we want you to kind of take away. But to be able to reinforce that through an open note is also a critical means of communication. A lot of our patients turn to open notes to help them remember. Again, so much information, challenges with being able to listen and convert that to memory all at the same time as during a physical or a telemedicine visit. Our patients go to their notes and use it as a means to specifically see how to take even their medications and their chemotherapies. And they feel more confident and comfortable knowing that the note also says what they remembered from the conversation that they had during their visit. Finally here, the notes also serve as a reminder. So there are a number of things that we'll cover over the course of a visit, from the clinical aspects, the prognostic aspects, the treatment aspects, from the social, day-to-day living, logistical aspects of care. And while we again may focus on things that are of higher priority, higher importance, there are a lot of other things that are still really important that we want to make sure that our patients and caregivers remember. And again, the notes can serve as a reminder for what things that they may forget, or can help remind patients to do their part in the treatment regimen as well, which I think is a strong reinforcement. Next slide, please. I do really want to call out here the special role for caregivers in the oncologic setting. We know that caregivers are generally very, very important as it relates to all kinds of healthcare delivery, but really in oncology, I find a very special role. Our caregivers oftentimes are the primary information source, primary assister with helping to make decisions, or doing most of the day-to-day living care tasks that our patients need, and really can help with determining how a specific patient's outcome really is. And caregivers really play a critical role and significantly can impact how a patient does from visit to visit. In particular, what we've found is that in our present COVID environment, there's been some new challenges because City of Hope, probably like a lot of other institutions, have had to limit the physical presence of caregivers, and our caregivers can't oftentimes be there with our patients in the same room. And again, this really presents a significant challenge because they're oftentimes relying on their caregivers. And what we've tried to do is through various means and looping in the caregivers through telemedicine, televideo, during their visit, but also leveraging open notes and the provider notes to serve as this crucial communication tool in reinforcing care plans, medication information, and things that we want to project and to make sure that our patients recall and take away from the visit so that they can have the optimal care going forward. Next slide, please. Finally here, I want to touch upon differential expectations, which I think we're understanding more and more about, but still is a topic that's in its infancy and we need to learn a lot more about. And I think that when it comes to differential expectations from patient to patient or between patients and providers, this really stems from a number of different factors. Clearly, we know that not all cancers are the same. Some act very aggressively, some don't. Cancers oftentimes can behave very differently in different people, and this is sort of the impetus for personalized or precision medicine, but also can create different expectations for people. Additionally, and we certainly can't have to really take this to heart, is that many personal history factors, preferences, influences, social factors cultural factors and other variables can play a tremendous role in impacting how we individually deal with cancer. And I've seen and seen this communicated to me as well, a very wide spectrum of expectations that our patients project. And it also affects the ways that we need to be able to put together our OpenNotes and communicate things through OpenNotes and help us manage our patients best. I've seen situations where wives don't want their husbands to know anything about their cancer or treatment. Other situations where wives want their husbands fully engaged, and they'll say, you know, don't talk to me, talk to my husband. I've seen some patients where they really want to know what's going on with their cancer, know as much information, do as much reading, and others that don't want to know as much information and want to play a little bit more of a secondary role. Some patients are feeling oftentimes fatigued or otherwise impacted by their treatments and feeling the effects of the treatments, such as chemo brain. And oftentimes we have to really take into consideration the status of a given patient's cancer in how they may be perceiving things and how they may be wanting to best communicate or be able to use their OpenNotes. And I think this is important, whether they're currently undergoing active treatment, whether they've been in remission for years, whether they're dealing with an active recurrence or progression of their cancer, or whether unfortunately dealing with end of life situation. All of these can play a different role in terms of how our patients are able to not only see or read their OpenNotes, but how we can best reach out to them from a communication standpoint. Next slide, please. Here briefly, I just wanted to share an article that I had the honor of being part of with Kate and Liz and some others here that really focuses on OpenNotes and oncology and really an assessment of the differences potentially between patients and oncology clinicians. And this was a large survey that was answered by more than 1,600 providers and 23,000 patients. And we specifically took a oncology-based focus on this and really found some interesting things that I took away from this. So first off, almost all patients, 98%, really felt that OpenNotes were a good idea. 70% of providers felt that OpenNotes were a good idea. But again, that's still a pretty big difference. I'm glad that still the majority of our providers feel that OpenNotes can be helpful for our patients, but I'd like to see these numbers be as close to 100% as possible. Also, for our patients preparing for their visits, about 56% of patients felt that OpenNotes helped them prepare for a visit, whereas only 28%, only half that number of providers felt that this could help their patients before their visit. Additionally, I think that as providers, we may underestimate our patients in a lot of respects. We think that their notes are going to confuse our patients, and a lot of patients don't seem to feel that way. In this survey, we saw that 44% of oncology providers felt their patients would be confused by reading their notes, but in getting the survey results back from patients, only 4% of patients actually felt confused reading their notes. So again, there's a big discrepancy, and we need to do our best to try to resolve these and improve the situation. Next slide, please. Finally, a few takeaway points I just want to leave here, and happy to pass this on to Dr. Weiss. So OpenNotes really can provide a very valuable resource for oncology patients and be a key communication tool. We clearly understand that there still needs to be much more education, both on the provider side as well as the patient side on OpenNotes, and really this is key to unlocking the potential that OpenNotes can really derive. Patients should be encouraged to ask physicians to make changes to their notes, and I've seen this happen on a number of occasions, but it serves to improve the documentation, improves data, improves communication, and just improves the provider-physician relationship. Especially as it comes to complex cancer care, there really needs to be heightened awareness of OpenNotes and ultimately we need to focus more on personal preferences and communication in order to really optimize the care for our patients. With that, I'll pass back to Liz.
Thank you so much for that presentation. And I wrote down that you said, as providers, we underestimate our patients. I think that's an important thing to think about as we see in the research and your stories. So thank you for sharing with us. I'm going to introduce our next presenter. Dr. Everett Weiss is the Associate Chief Health Informatics Officer for Memorial Sloan Kettering Cancer Center. He's board certified in both pediatrics and clinical informatics. And Dr. Weiss leverages his clinical, vendor, and executive informatics experience to digitally enabled patient care. We first met Dr. Weiss when he was in a different part of New York, working with Roswell Park Cancer Center and their rollout of OpenNotes. And today he's sharing a bit about his experience from Roswell Park and perhaps giving us an idea of how things are going at Memorial Sloan Kettering. So Dr. Weiss, I hand it over to you.
All right, well, thank you very, very much, and I appreciate the warm introduction. Thank you again, Dr. Yuh, and also to Rosie. These stories are so critically important to really emphasizing the reasons why we are doing the work that we're doing with regard to OpenNotes. And so I'm honored to be able to share a little bit about, what we've learned and how we can continue to do better as an industry, as collaborators in helping to care for our oncology patients. So with that, we will go forward. What I really wanted to share with you is that change is hard, and we know this. And, we are actually standing on the shoulders of giants because a lot of the hard work has actually already happened. And the roads have been paved for us to continue to do the work that has been done before us. And we can help benefit so many more patients. And the context of today's webinar is really how do we continue to extend that benefit, but more specifically to the oncology patient population. And as you've already heard, there is real benefit. The circumstances may be different, but the benefit is real and it's ever present. So the first thing that we really need to recognize is that when we undertook this, we recognized and marketed this as not being a pilot, that the work had already been done, the benefits had already been proven, and it had been documented many, many times. It started in 2012, and it has continued through so many different publications that have followed ever since. Next. Next slide, please. So we also wanted to really emphasize that it was going to be hard to bring everyone on board, particularly at a very large organization. There's a lot of different feelings about, how OpenNotes was going to dramatically change workflows and burden, office staff with extra phone calls and managing documentation changes and the like and requests. And what we really wanted to focus on was not so much in securing consensus, where we had 100%, alignment, that this is what we were going to do, but instead secure commitment that this was the way that the organization was going to move forward, because the organization felt that it was in the best interest of both our patients, but also for the entire clinical care team in helping to provide the best oncology care that we could as an organization. So that was a really, really important step that really came from our senior leadership across all organizations. Next. So the other really important thing is anything that is this big of a change effort really requires champions. And champions are going to be different at every organization. And so it's really, really important that you look at the people in your organization, the leaders in your organization, the people who are able to affect change and who are able to bring people along and identify those people individually. They vary really from organization to organization, but most times you know who those people are. And sometimes it requires a little bit of extra work to identify. But those are the people, once they're identified and once they're engaged in rolling out OpenNotes to the organization, are really going to help carry the rest of the clinical staff to being able to do this successfully. Next. So we've often focused on the benefits of doing OpenNotes, and you've heard a lot about that today. Here are all the reasons why you should do this. And those are really, really important, but there's also a flip side to that question. And it's the answers to the question of what will happen if you don't do OpenNotes. And there are, in fact, some very real consequences to pay attention to. And they might differ depending upon your organization, your community, your patient population, certainly, as it relates to the experience that your patients are going to have as they navigate a complicated healthcare system within their community. Patients no longer are just seen at one organization. They go to many different organizations to get different kinds of care, whether that's their primary preventive care, their oncology care, or their ancillary care. And it's important to recognize that the experience that our patients will have are going to be different. And to the extent that we can unify around a common experience where patients can have information at their fingertips and better understand their care and better be able to share that with their caregivers and their family, the better our patients are going to fare. So I encourage all of us to ask the question, what are the consequences of us not participating in OpenNotes? And let that also be a driver for all, to support all the reasons that we ought to be doing it and the benefits that are associated with it. Next. So Dr. Yuh had done a really beautiful job of really articulating how does oncology differ from the rest of a healthcare system. So we have the benefits of being purely an oncology center, but a lot of organizations have oncology as being one of dozens of different specialties that are offered within their organization. And regardless of what organization you participate in, it is really, really important to understand how oncology needs and patient needs in the oncology setting differ. So I just want to reiterate, all of the wonderful bullets that Dr. Yuh had presented earlier, because that will help to drive a more successful implementation of OpenNotes. Next. So we started off at the top of the webinar today, really talking about a lot of the different things happening, in this space. And it's really important to differentiate a lot of the work that's being done to promote result or report release so that our patients have access to that information, and compare that and contrast that with releasing and making available OpenNotes, so the clinic visit notes that our clinicians will write. They both have extraordinary value, but they very much serve different purposes. And I think that Rosie's story at the top of the webinar really articulated some of the unique benefits that an oncology note can provide to patients, caregivers, and family as compared to just simply releasing results and reports alone. Next, please. And what I would end with here is that we really can do a much better job at offering support to our clinical staff for how to have better conversations and to better document these conversations and these clinical visits with our patients. It is undoubtedly important that these notes remain medical as a form of communication from provider to provider so that the care team can have all the information that they need to care for patients across the spectrum of specialties. But these notes also have a really critical value in helping our patients to understand what is happening with their care. Not only what is happening present with the diagnosis, but what is expected of them and what are the possibilities of care going forward in the future. And we have a real strong obligation to make sure that our notes are accurate and that they benefit all involved. And we've heard many, many times, and this is well documented in the literature on OpenNotes, that patients don't request that we rewrite our clinic visit notes, at a patient-friendly level. They want to see the notes as it is written for the medical communication from provider to provider. And this often sparks better and higher levels of understanding among patients and their caregivers, which also have downstream benefits as well. Next. So Dr. Yuh had already highlighted an article that he published, and I am so glad that he had the opportunity to do this because this work is so, so important. So what I'm going to highlight is just a small example at another organization that we were able to measure this same difference. And it is important that we recognize that there really is a remarkable discrepancy between what our providers think and fear about OpenNotes and what patients think or don't fear about OpenNotes. Next. So what you're going to see on this graph here is that we really get to appreciate the distinct difference in a visual way between what our patients and our clinicians are reporting, about their views of OpenNotes. And, this is a small sample size compared to the work that Dr. Yuh had done, but it illustrates that it doesn't matter which organization or center you're at. The fact is that there is a real difference in the perspectives between our patients and our providers. Next. What we looked at in our survey was we were trying to look at, whether patients felt that they had control over their care, whether they were worried more after reading their note, whether they had more confusion after reading their note, whether they remembered or they understood the plan of care better. Was there any impact to them taking their medications better after reading their notes? And how prepared or ready were they for their next clinic visit? And again, the important thing here to realize is that when we looked at all of this data between providers and patients, there was a distinct difference between the two. And so what this tells us is that we really need to take a very close look at our own fears and our own perspectives and how that might differ from the reality of what is wanted and desired from our patient population. Next slide, please. So what I encourage us to do, and what I wanted to just take a couple minutes to talk about, was what is the next level thinking that we ought to have about OpenNotes? Because sharing our clinic visit notes is only the first step, but there's so much more that we can do to continue to improve that dialogue with our patients and increase understanding. So I've divided this up into things that we can accept as truth and then questions that we should ask ourselves going forward as we continue to roll out OpenNotes in our respective organizations. Next. So as Dr. Yuh had already talked about, notes aren't error-free. Unfortunately, they never will be. And so how can we capitalize on an extra set of eyes to facilitate the process of increasing the accuracy of our notes and getting that feedback from our patients and being able to update our notes so that it's not only accurate for our patients, but it's also accurate as we share these clinical notes with other providers who are also involved in patient care. Next. So we use a lot of acronyms, and this is shorthand for medical providers, and we can understand this. But is there a better way that we can decrypt our notes? Not take acronyms out of the notes, but can we increase the understanding for our patients by putting legends, with our shared notes, explaining what these acronyms mean, hover overs, anything that can help, increase the understanding of the meaning behind these notes. Next. We have to remember that we actually write things to remember them. So how can we leverage notes for more focused conversations at the next visit? Are there ways that we can use and leverage our OpenNotes to drive conversations about questions that patients have from reading their last visit note and prepare that and present that to the clinical staff at the time of their next visit? Next. We also have to remember, and this has come up earlier today, that many are involved in the patient's care at home or away from the hospital. So how can we increase their understanding of the patient's diagnosis and treatment care plan? It's not just about sharing these notes with patients, it's also about making them available per the patient's request to other people. And how can we better facilitate the sharing of this when so many other things are able to be shared so easily across different individuals in our everyday lives? Next. Reading another's recollection of an event can trigger clarifying questions. So we thought we understood something, and we read something that differs from that. And so it might trigger questions that can have real implications for how we care for ourselves or how we care for our family and loved ones. So how can we direct the patient to the right person at the right time when those kind of questions arise when reading an open note? Next. And we want to remember, as Dr. Yuh had described, that visits often feature life-changing diagnoses or treatment decisions. So how can we better talk with patients so that there's an understanding of what they're going to read in their clinic visit note? How can we document conversations differently? We know that in the oncology setting, we encounter and initiate some very difficult conversations, and people cope very differently with that information. And this is important to document, and sometimes it can be very jarring to read that, about, a conversation that took place. So how can we better capture that in our clinic visit notes while still documenting what happened, but being very sensitive to the fact that a difficult conversation just took place? And similarly, along the lines of conversations, is how do we document very sensitive observations? And clearly there's different ways that we can do that, and we can help our clinicians to be able to document differently, not again to change the meaning of what happened or to withhold information, but just to be more aware and to better have open conversations with our patients in anticipation of these notes being shared with them. So thank you very much. I look forward to answering any questions that you have. And again, thank you to my co-presenters today. Thank you, Liz.
Thank you, Dr. Weiss. That was awesome. I love that you got straight into that practical next level thinking and things people can be thinking about. So we're going to transition quickly into Q&A. Start typing your questions in the chat box. We only have a few minutes left, so I want to remind you, later this week, we're going to have open office hours all around open oncology notes, where we're going to answer all the questions. We do have coming up in the next few weeks more webinars. We've posted a link to that in the chat box, where we're talking about open inpatient notes. We're going to do a walk-in clinic for an entire week of March 29th through April 2nd, where you can come and join us and ask any of your questions about open notes. And then we're focusing on open notes in the safety net starting on April 15th. All right, I invite all of the presenters to join me back on camera, and let's see, and then Deb Wachenheim will be presenting any questions received in the chat box, and anyone is welcome to answer. Deb, what are we hearing in the chat box?
Great. So Dr. Weiss, you touched on this at the very end of your presentation, but if you or Dr. Yuh have more to say, and Rosie, if you have anything to share, someone said a concern oncologists have is causing distress to our patients if they read our thoughts about sensitive topics such as prognosis. Can you comment on how poor prognosis can be communicated in a note that a patient would be reading? We are accustomed to writing notes intended for other clinicians that may be short and on the surface, I worry, seem insensitive.
Sure, I'll start, and then I'd be interested in other comments as well. I think that these are, we know that we are having these very difficult conversations with patients, and I think it is important to let patients know that it's important that we capture this in the clinic visit notes, that we also have different ways of using adjectives or words to describe what really transpired. But I think that the more that we educate our patients that the clinic visit note is used to capture the events that happened in that encounter, there's greater understanding And I think the words that we use can certainly soften some of that, but it doesn't change the fact that, you know, a difficult or an unfortunate prognosis, you know, was discussed. And I think that sometimes reading something that happened can be difficult, but we can acknowledge that up front in the visit before the clinic visit is actually documented.
This is Rosie. For me and for David, it was the transparency was important. The information and honesty was important to us. And the honesty that we had in the office visit was just as important to have that in the notes so that we could share that with our children. Also, I remember a televisit call that we had where David was asked how much time he had, and he was told he had less than 6 months and probably on the short end of 6 months. And he then proceeded to say, "Thank you, doctor," and hung up. And when we went back to read the notes, he said, "I'm sure glad David's coming in 2 days because I don't think he understood everything I was saying." And you know, he did, because I said to David when he hung up, I said, "David, you just thank that doctor that told you you're going to die in less than 6 months." And he said, "It's not his fault." And that's how he felt about it. But the doctor picked up on that. He picked up on the fact that, and he was honest, and he put it in his notes so that we could address it when we came in. That yes, David did understand his prognosis, and but he didn't blame anybody for it. And I think that's really important, that transparency doesn't mean that hard stuff can't be said.
Yeah, I completely agree with Everett and Rosie on this. The transparency, the honesty, the you know, being empathetic. These are all important factors. I think, you know, we obviously have to be nuanced about more sensitive topics, but at the same time, I think we have an obligation as providers to be able to communicate what prognosis truthfully, realistically looks like. And the note, there shouldn't be things that show up in the note that honestly show up as surprises to our patients. So if things are as we believe them to be clinically, we have an obligation to be able to communicate that so that it doesn't seem a surprise at all within the note itself.
I do want to acknowledge we're at time. For Deb, if we have a few more questions, I don't know if our presenters can stick around a few more minutes to answer maybe 1 or 2 more questions.
Sure.
There is a question about the time frame from the visit to when notes are made available.
Kate, is that something you can answer?
Sure. I think it's going to vary by organization, but the rule does say that the notes have to be, that the information has to be available without delay. So most places that we have been talking to are releasing the note when it's signed.
And then there was a question, any perspective about mental health or social work notes? So if you have anything to touch on in terms of what your institutions do in those areas.
Sure. You know, this is always a very important area. There are certainly certain elements of clinic visit notes that, you know, can be separated from the clinic visit note. And so it really depends, and it is a decision from an organizational basis. There is no one solution for all organizations, and it really depends on how notes are configured and where information can be input into the legal medical record. So different organizations have chosen to handle it differently. Sometimes there's different notes that can be written to house different information. Sometimes there are components of the note that can be you know, hidden and sequestered, if you will. So it is important to recognize that one of the very important things that we do have to also comply with are rules around, you know, this type of private information that should not be released. And so there have to be mechanisms in place. But that's no different than it really always has been, and that's independent of OpenNotes and the Cures Act as well.
And then there was a question, are you sharing tumor board notes?
That's a great question. So we have not done that as of yet, but we are actively talking about what we should be doing with those notes. These are very important notes in the conversation. And I think at every organization, it's an evolution of what kind of notes are being shared. Obviously, there are some rules that are present right now with the Cures Act as far as different elements of data sets that need to be made available. And then there is the more global spirit of OpenNotes, which is, what information do we share? And I think that, as we talked about, there's so much information that can be shared. It is so important that we share relevant information without overwhelming the patient and their caregivers with everything that is in, our EHR systems, because we can very quickly lose the value that we pretend to our patients. So it is a delicate balance, but there are definitely some very valuable notes that extend beyond just the office visit notes as well.
Since we are over time and everyone needs to go back to their busy lives, I want to say we're closing the presentation now. Please join us on Thursday. We're going to do all Q&A for a full hour with the same presenters from today. I specifically want to thank Rosie Bartel for sharing her story and her story with David. We got a number of comments in the questions area of people just thanking you, Rosie, and I want you to hear that out loud. We really appreciate you sharing that. And I also want to thank, Dr. Yuh and Dr. Weiss for joining us and sharing what they've learned both through research and real-world experience with OpenNotes. Everyone who signed up for today's webinar, you will receive an email in the next few days or so with a link to the recording, which you can watch again, share with your colleagues, because now that you've attended this webinar, you're probably one of the most knowledgeable people at your organization about OpenNotes in oncology. So share what you've learned with others and spread the word. The office hours section that we have on Thursday is not recorded, so feel free to bring your questions and just know you have a safe space to ask and have those questions answered. And remember to visit opennotes.org for free resources and information. I saw somebody who asked a question in the chat box about how do you talk with patients about OpenNotes. We have other webinars about that specifically and links to resources. Again, thank you to today's presenters. Thank you to you for signing up and showing up, and we'll see you next time. Thank you.